Sequential organ failure assessment score. First we see the respiration, PaO2 by FaO2. If PaO2 by FaO2 is more than 400, score 0. If less than 400, score 1. If less than 300, score 2. If less than 200, score 3. And if less than 100, score 4. And next we see the platelet count. If more than 1,50,000, score 0. If less than 1,50,000, score 1. If less than 1 lakh, score 2. If less than 50,000, score 3. If less than 20,000, score 4. And next we see the bilirubin. If bilirubin level is less than 1.2, score 0. If bilirubin is 1.22, score 1. If bilirubin level is 2 to 5.9, score 2. And if bilirubin level is 6 to 11, score 3. And if bilirubin level is more than 12, score 4. Next we see the mean arterial pressure. If mean arterial pressure is more than 70, score 0. Mean arterial pressure less than 70, score 1. If patient requiring dobutamine less than 5 milligram, score 2. If dopamine 5.1 milligram or epinephrine 0.1 milligram or norepinephrine 0.1 milligram infusion required, he is given a score of 3. If the patient requires dopamine more than 15 milligram and epinephrine of more than 0.1 milligram and norepinephrine of more than 0.1 milligram, score 4. Next we see the GCS score. If GCS is 15, score 0. 13 to 14, score 1. If 10 to 12, score 2. If 6 to 9, score 3. If less than 6, score 4. At last we see the creatinine. Creatinine of less than 1.2, score 0. Creatinine of level is 1.2 to 1.9, score 1. If creatinine level is 2 to 3.4, score 2. If it is 3.5 to 4.9, score 3. And if creatinine level is more than 5, he is given a score of 4. SOFA score is validated for both medical and surgical ICU patients. If SOFA score is 0 to 6, mortality rate is less than 2%. 7 to 9 has a mortality rate of 0 to 10%. And 10 to 12 has a mortality rate of 10 to 30%. And SOFA score of 13 to 14 having a mortality rate of 40 to 60%. And SOFA score of 15 is having a mortality rate of 75 to 90%. SOFA score of 16 above to 24 is having a mortality of greater than 90%. If you like this video, subscribe to our channel